I probably wouldn't go that direction in my office. I don't treat as much of that as you do, but I treat a fair amount. And he's 37 years old. You know, and I think you're seeing a difference sort of in styles. My job here is to try and restore hormone function, you know, try and get his own testosterone up. I would really be reluctant at 37 to put him on it unless I really had to, and I would really try and avoid the naltrexone. There's great data. There is. But it's a synthetic model, and that's that replacing of a hormone instead of trying to restore it at 37. And I think that's why I went with more of a vitalist type of movement with him, with, you know, colon hydrotherapy and greens and things like that. And for me, I have to clear the bile out of his liver, because if that bile just spurts between 2 and 4 in the morning because his liver's sluggish, then his intestines are going to get irritated from that bile, while if that stuff is just sitting there all night. One of the priorities that I haven't brought up is I do need to clear his liver. That is something, whether it's a liver detox with herbs or however it would be, a constitutional hydrotherapy followed by colon hydrotherapy, which I do a lot of in my office, but I would absolutely have to clear that liver. And then I would hope that he might restore. Maybe he needs a little DHEA to push it up, but I would hope that. I'm a bit of an idealist. 37-year-olds aren't restoring as much as they used to.
I get where you're coming from, and it's interesting to get a naturopathic perspective, because we come from a more pharmacological model, a more synthetic model. The reason, and I totally endorse your viewpoint, and I would really like to see the guy med-free. And it is problematic to put 37-year-olds on testosterone because it makes them infertile, at least while they're on the testosterone. But I think of it as more of a temporary reboot. This is a sick guy. That would be my rationale. And virtually all my patients who come to me in a sort of a crisis management mode, who require the testosterone, they're usually off it within 6 to 12 months.
So yeah.